Assalamualaikum and salam sejahtera to Sir Farid Ahmad and my fellow coursemate. My name is Muhammad Anwar Redzuan, my metric number 2020-856068, and I am from class RSR 2452A. Today, I want to share with you guys on how to do splinting for assignment SPS 462. What is splinting? A splint is used to stop an injured body part from moving. When a broken bone is bent or showing through the skin, it should not be straightened. Splints support and immobilize suspected fractures, dislocations, or severe sprains, to help control bleeding, to help control pain, and finally to prevent further damage to tissues from the movement of bone ends. Today, I would like to do demonstration on how to do splint for broken leg on emergency situation. Equipment that needed for emergency splinting is rigid to stabilize the fracture. For example, something made from wood, aluminum, wire, plastic, cardboard, or compressed wood fibers that available and you can find at that situation. Secondly, clothes or object that can be used for binding and not harmful. This is the step on how to do splinting for broken leg. So now, we move to the first step on how to do splinting. The first step to do the splinting is attend to any bleeding. Observe the injured part of the victim legs. If it occurs during bleeding, you must treat the wound before starting splinting. The victim at the time is not visible bleeding therefore, and you can proceed to the next step, that is apply padding. The second step on how to do splinting is apply padding. Apply a bandage on the injured area so the injured area will be protected and the victims will feel more comfortable, like this. The third step is place the splint. Place a splint on the side of the injured leg as well as the fractured bone. This is the splint. And put it aside on the injured bone. After you place the splint, you can start bandaging. Make sure when you apply the bandaging, the bandage is not too tight and not too loose. After you done splinting, watch for the sign of decreased blood circulation for a few minutes. If you find the blood circulation is not going well and the victim complains that the bandage is too tight, you should loosen the bandage a bit. The final step after you do splinting is call for expert medical help. You need to call emergency medical service 999 or rush to a nearby clinic or hospital for further treatment. This is situation when you should seek immediate medical help if the situation below occurred. Firstly, bone protruding through the skin, loss of senses of touch on the part of the injured victim. Skin have turned into blue and lost sensations, and finally, victim had an open wound at the injured area. The conclusion for the splinting is, when faced with a situation like this, you should be wise and not panic in taking any action. Early treatment such as a splint is very important and can reduce the victim's pain if the condition of the injury allows for splinting to be performed. Therefore, knowledge in the treatments of splinting is very important for dealing with emergencies involving bone fractures. That's all from me for now. I hope this video can be useful. Thank you so much.